My FSH is under 10 for day 2 to 4 of my period, but it jumps to 60 on day of ovulation. Is that an issue? I'm Dr. Dan Nayat. I'm the Chief Medical Advisor here at Bird and Bee. Most hormones will sort of move around through the cycle, but there's general patterns. For example, FSH at the beginning of the cycle, we're talking day 2, 3, 4, we expect it to be on the lower end, less than 10 or less than 12 or something like that. We actually use the day 3 FSH as a measure of ovarian reserve or ovarian resistance. For example, one of the diagnoses of menopause, other than the symptoms of having no cycles and hot flashes, is a super high FSH, but it matters when you take it. If you've got regular cycles, we're pretty confident you ovulate. But if you ever looked at this menstrual cycle chart, everybody knows about this LH surge. So that happens in the middle of the cycle. In fact, there's a hormone from our hypothalamus to our pituitary called GnRH, and that hormone surges and it tells our pituitary to release 2 hormones, not just LH, but FSH. So there's actually an FSH peak in ovulation as well. In fact, that's why some doctors, when they do the trigger medications, some will try to do a dual trigger versus a single trigger to try to mimic both the FSH and the LH surge. An FSH peak in the middle of your cycle, if you've got regular cycles, is actually quite normal.